Welcome to the CyberKnife Center of Miami, the beam of life. This story is not just about beating life-threatening and heartbreaking cancer. It's about inspiration and hope when sometimes there is none.
This is a Toulouse track, and it's called the Deux Danseuses de Cancan.
It's about once again believing in tomorrow by giving patients another option. Each person coming through these doors is battling a different type of disease.
Good afternoon.
For some, it's cancer. For others, benign tumors. All are looking for help, and maybe even a miracle. If anyone knows about fighting cancer, it's Leonore Rivakova.
The first is an initial shock, and I think everybody goes through that.
Ovarian cancer spread through her body. The tumors kept coming back. Her doctor delivering devastating news.
He pretty much told me that there was nothing else that he could do for me.
Luckily, a friend told Leonore to get a second opinion at the CyberKnife Center of Miami.
Oh, they told me it was totally treatable, which was the best news I had heard in many months.
With too much life to live, 18-year-old Jose Bacardi wasn't about to let bone cancer, which spread to a lung, get the best of him.
Well, at first it was scary because, I mean, it's cancer, you could die. But then my doctor told me that I had an 80% chance to live.
This is a carbon Lagos.
Never sick a day in his life, Ricardo Suarez was suddenly fighting for his life. Colon cancer had spread to his liver. He was given a 20% chance of survival.
It's an amazing, amazing, amazing piece. Well, the word cancer is scary in itself, and then once you're diagnosed with it, it's like getting hit in the head with a brick.
Rick, Jose, and Leonore kept a positive attitude, took charge, and began researching treatment options. Armed with new knowledge, all chose the CyberKnife Center of Miami.
The CyberKnife is frequently allowing us to treat many tumors, both cancerous and non-cancerous tumors, that we weren't able to effectively approach before. In some situations, the CyberKnife should actually be the first treatment option that patients consider.
The CyberKnife is not a knife at all. It's state-of-the-art robotic radiation technology. Patients feel nothing as radiation beams with the highest dose possible attack the tumor from dozens of different angles.
What that means is that we're able to accomplish the same or greater tumor cell kill in a smaller number of treatments over a shorter period of time.
The CyberKnife's missile technology can follow tumor motion during normal breathing cycles. Its pinpoint accuracy targets only the tumor. Healthy tissue is unaffected, making it a good choice for Rick's liver tumors.
We had 10 lesions, and they're approximately the size of a golf ball. CyberKnife was my only shot at that point.
Unlike surgery to remove tumors, there is no cutting, anesthesia, blood, pain, or recovery time. Recurring tumors can be zapped again if necessary.
Put it on a big one.
We can treat patients repeatedly over a period of time and, in a sense, begin to manage advanced and metastatic cancers like a chronic disease and keep the patient comfortable, functional, over a longer period of time.
Prior to treatment, I couldn't get out of bed. The 2 or 3 days into the treatment, I started feeling better. Then I was thinking that there is hope here and that maybe I'll have a few more Christmases and see my daughter graduate, things like that.
The CyberKnife can kill tumors almost anywhere in the body, including brain, lungs, liver, neck, spine, pancreas, prostate, and those deemed inoperable. If you're a candidate, you might be able to come here, get your tumor zapped, and about an hour later, do anything you want.
After CyberKnife, I didn't feel absolutely any side effects. I drove home and I came home and I played video games. I walked with my mom sometimes.
I would get up every morning, go to work, and in the afternoon I would go to CyberKnife and then come back home. Just lead a normal life. I went back for treatments too many times to count, thanks to CyberKnife, that I am here today.
The public should be made aware that this is incredible technology that's available now, and you don't have to die.
There are probably a lot of patients who might benefit from this technology who are either unaware of it or don't have access to it.
Thank you very much. I'm here for my appointment. The staff is professional. I can't say enough about them. They certainly cater to the patient, and it was not only me, it was other patients that I saw coming and going. They were very happy and well taken care of.
CyberKnife Center, Miami.
CyberKnife has given Leonore a second chance at life and more precious time with her grandson.
Well, I'm looking forward to see him grow up, to traveling with my husband on retirement, and living a full life.
I'm looking forward to life without cancer, and hopefully it'll be a long one.
Yeah, I wasn't going to let some disease tell me what I can and can't do and what life I can and can't have. I woke up every day and I went to high school, and eventually I graduated and I did get into a good college, and I'm going to the University of Virginia on a full scholarship to study aerospace engineering in August. At first I did think my dreams may not come true, but then I realized that I wasn't going to let it do that, and my dream was going to happen. It was going to.
Call to find out if you or a loved one are a candidate for CyberKnife. The beam of life.